Well, good afternoon, everyone, and thank you for taking the time to watch and listen today. First of all, I would like to invite the Minister for Health and Social Care, David Ashford, to give you a brief update on the work to return our health service, particularly elective procedures at the hospital, back to normality. David.
Thank you, Chief Minister. In terms of the health services, we now have theatres back to normal and fully operational, and as a result, elective surgery is also now back up to pre-COVID levels. Endoscopy is now also up to previous levels, and the integration project is now back up and running, looking at how we can expand our services. We have now also completed our winter planning and how we are going to be able to provide protective capacity to be able to maintain elective surgery levels, as well as maintaining a COVID response and dealing with the usual increased pressures on services seen during the winter months. We are also beginning to draw up waiting list initiatives to look at how we can address the backlogs that have built up in certain areas over the COVID period, something I acknowledged a few weeks ago that we were concerned about and we were keen to get movement on. And I hope that I will be able to make further announcements around that in the very, very near future so that we can bring the lists that had built up back down to ordinary levels. Thank you, Chief Minister.
OK, thank you very much, David, and that's very encouraging news. Now, since I last spoke to you, the island has seen 5 new cases of COVID-19. Thankfully, all have been people who were in self-isolation, and so our community remains free of the virus. Now, whilst this may have been only a handful of cases, I know the trickle of announcements in recent days has caused understandable concern. Across the water, the battle against COVID-19 is still, sadly, going in the wrong direction. The expected surge in cases that everyone had hoped could be avoided has come to pass. 2 weeks ago, I spoke about the record high in the United Kingdom of more than 7,000 new cases in a day. That figure has doubled in a fortnight, with 14,500 new cases diagnosed on Tuesday. The United Kingdom is continuing a programme of measures to try and control the spread of the virus. This is happening at both a national and local level. Yesterday, the First Minister of Scotland, Nicola Sturgeon, announced a return of tougher restrictions, with pubs and restaurants across central Scotland ordered to close tomorrow at 6 p.m. until at least the 25th of October. The Prime Minister Boris Johnson is widely expected to follow suit on Monday for England. Now, clearly, the situation in the United Kingdom and further afield is serious and deteriorating. This is reflected in the number of cases we are detecting in residents returning and key workers coming to the Isle of Man. It will come as no surprise when I tell you that the Council of Ministers has determined that we will remain at level 4 of our borders framework. Now is clearly not the time to loosen restrictions. But we must ask ourselves, are the measures that we currently have in place enough to protect our island and our community, given the exponential growth of the virus in the United Kingdom? There are some who want us to return to level 5 of our borders framework, and I understand this. And despite what is unfolding across the water, there are still some who would like to see restrictions here relaxed a little more, to at least allow immediate family members to come to our island. Our new level 3A, and I understand what an emotive issue this is. The Council of Ministers this morning discussed the worsening situation in the United Kingdom and decided that, on balance, stricter measures are required in order to reduce the likelihood of the virus returning to our community. I can announce then that the option to have a test on day 7 of self-isolation will be withdrawn for anyone arriving on the island after the last flight and ferry this Sunday, the 11th of October. Residents returning to the island from Monday onwards will be required to self-isolate for the full 14 days, what is known as the gold standard in preventing the spread of the virus. Anyone who has had their day 7 test received a negative result and is now in their remaining period of modified self-isolation, so that's people in days 8 to 14, will not be affected by this announcement. Your modified period of self-isolation, which allows you to exercise and to attend work if appropriate safeguards are in place, will continue. Now, I know this change will disappoint and frustrate some people. For others, you may feel it does not go far enough. As I've spoken about on many occasions, the Council of Ministers carefully examines the balance of risk. These decisions are never easy, and we always try to do what is in the best interest of our island. We feel that remaining at level 4, but returning to the gold standard of 14 days of mandatory self-isolation, will shore up our defences against the potential return of the virus. We will, of course, keep the situation under review. We very much hope that the option for a test on day 7 of self-isolation can be reintroduced at some stage in the future. All of us must remain vigilant if we are to protect our Manx bubble, which was hard won. Vigilance must be our watchword. We are only as strong as the weakest link in our chain. The actions and behaviours of each of us could make all the difference. And I know you know this, but forgive me if I say it again. If you have travelled to the Isle of Man from the United Kingdom, you must go directly from the airport or the sea terminal to your place of self-isolation. No stopping for petrol, sausage rolls or alcohol. Our visiting key workers are also required to self-isolate. All that differs is the modified conditions to allow them to safely carry out the important work for which they have been brought to the island. When doing so, strict safeguards are in place, including the use of appropriate PPE, limited contact with other people and social distancing. When not carrying out their essential work, these individuals should be at their accommodation isolating. Now, on the topic of visiting key workers, I am conscious that there has been concern in our community following a small number of these visitors willfully breaking the rules. It has been both disappointing and unfortunate. It is not just a breach of the rules and our laws, but also a breach of our community's trust. The rules are clear. Our entry certificates for key workers are clear. It is there on the front page in red, bold lettering. And whilst I firmly believe that there are no excuses for ignorance of the law or a wilful disregard for the rules, we of course want to do all that we can to make sure non-residents coming to our island as key workers understand what is required of them. We want them to appreciate that they have travelled to a different jurisdiction, to a place that, for now, is free of the virus, and they are in a community that does not want to see that virus return. With this in mind, we have this week introduced new lanes at the airport and the sea terminal for arriving key workers. This is to ensure that officers from our COVID response team can fully explain and emphasise the rules, why they exist, and the consequences for not following them. We have worked with the Isle of Man Steam Packet Company and Logan Air to introduce onboard tannoy reminders, and we are placing yet more banners at our ports to draw people's attention to our rules and sanctions they could face for violating these. On Tuesday evening, I went to the sea terminal unannounced and witnessed for myself the processes in place for returning residents and arriving key workers, and I was satisfied with what I saw. Every individual was spoken to, including those disembarking by car. I am sure these measures and recent publicity will leave no doubt as to the seriousness with which the authorities and you, our community, view these rules. Nonetheless, the breaches have been both disappointing and concerning, and so the Council of Ministers has requested a review of the measures, processes and procedures in place, and I will of course update you once this work has been completed. Despite the small number of breaches, we must bear in mind that visiting key workers come to our island for a reason. We are a small community, and there are many aspects of island life that are dependent upon specialised and skilled workers coming to our island. from life-saving medical equipment at our hospitals to our electricity generation and numerous other critical services. The vast majority of the key workers coming to our island follow the rules, and we are grateful for the vital contribution they make in keeping our island running. The final point I want to make today is to leave you with a clear message. Be prepared. All of us need to be prepared for the return of the virus and what that may mean to our society and our economy. Be ready to act, whether it's a return of social distancing, protecting our most vulnerable through shielding, or queuing in a socially distanced way. What we have achieved in keeping the virus at bay for so long is truly remarkable, and it is thanks to you, the great Manx public. I hope we continue to succeed in preventing the virus's return. Government is ready, and I want to ensure that each of you are as well. And now to questions from the media, and first I have is Simon Richardson from Business 365. Good afternoon, Simon. Fast am I.
Good afternoon, gentlemen. First question, if I may, is for you, Chief Minister. In respect of key worker status, are you satisfied that all the people being designated as such truly match the criteria? I mean, a couple of the people jailed recently for breaking the COVID isolation rules were actually teenage apprentices. I mean, would they seriously be classed as key workers?
Yes, well, I looked into that one, Simon, myself, and the specialist job that the key welders do is that effectively they put an explosion around the two ends of a railway track. Now, that is something that doesn't happen on the island, and they have their helpers that come over and help them do this procedure, who were the apprentices. So we don't have anyone who has dealt with, and probably doesn't have the health and safety insurance as well, to deal with the explosive side of the materials that are wrapped around the rails in the special procedure to join them together. So, yes, obviously we are reviewing this, Simon, and if there are any loopholes that we haven't spotted, then of course we will. But I have satisfied myself that whilst they were apprentices to an exceptionally rare and specialist procedure that I'm led to believe can't be done on Ireland. I know, David, you've looked into this too. Is there anything you'd like to add to that?
Yes, thank you, Chief Minister. It's to do with the thermite powder. They have to basically wrap thermite powder around the rails and ignite. It's a very specialist procedure that's outside of ordinary welding. The apprentices assist in that with the actual people who are qualified to do so. So they come as a team, basically, in order to do it. So from a health point of view, we had this looked at as well, and we've been told that there is no one on Ireland who can actually undertake that work. It would have to be key workers brought in from off Ireland.
If I can just expand on that, Simon, because obviously this is a worry for members of the public. I get that, and we've done a lot of research into this. I'll just give a definition of what a key worker is. I know, Tim, you asked me the question last week, and I just want to reiterate the definition. It's a worker who is essential to the maintenance of critical national infrastructure, to the preservation of life and health and care of the community, or in the interests of the economy of the island. Now, since the 27th of May to the 27th of March to the 2nd of October, we've had 1,229 key workers come to the island. The majority are from the Department of Health and Social Care, which is, you would expect, about 187 from business. But it's not a significantly large number, but we've heard very little of those 1,229. It's just the odd, irresponsible ones who have been caught and punished. So let's not tar all our key workers with the same brush as what we've recently experienced. And your next question, Simon.
The second question, if I may, is for the Health Minister. Of those currently isolating with the virus, have any required hospitalisation?
No, thankfully no one has required hospitalisation. Most of those that have been identified have been asymptomatic, so they haven't even been showing symptoms. It's been brought up by the fact they've had the 7-day in test.
That's fine, thank you.
Thanks very much, Simon. And I move to Alex Bell from BBC Isle of Man. Good afternoon, Alex. Fast am I.
Yeah. Good afternoon. You've mentioned some of the criteria for key workers there. With the likes of railway workers, is the work so necessary that it has to be carried out in the immediacy? In other words, can it not wait to factor in an additional 2 weeks to allow for a period of self-isolation?
Well, obviously, we are employing people off Ireland who have jobs to do, and if they're having to spend weeks in quarantine before they can do any work, then we're not going to get too many people who are prepared to come over to do the job. Their own company will need their work. So obviously we're reviewing this, Alex. If there's a way of improving the rules and regulations to narrow down the numbers, then we will, of course, do this. And I promised you that next week I will come back after the Council of Ministers has read the paper that we've commissioned into looking at our key workers to see if there's any way that we can improve the methodology and the numbers that are coming onto the island. But as I said, it's 7 months. There's only been 1,229, of which nearly half of them have been key medical workers. So we're not talking large numbers here. And as I say, the vast majority have respected our rules and regulations. And I think the publicity of the recent cases will, I'm sure, focus the minds of people now coming over to do projects on the island. Your next question, Alex.
Yeah, just further to that, the last time I saw an MER tram passing, there were about half a dozen people on it. Is the railway really critical national infrastructure?
Well, obviously that's a decision the Minister for Infrastructure decides based on the fact that we've had people coming over from Guernsey, a considerable number who have all been taking part in our heritage railways, whether it be the electric or the steam, and we've seen by the numbers a considerable uptake in these areas. And we've tried to give people the normality of as much as pre-COVID as we're experiencing now. So obviously I'm sure that will be part of the review, but at this moment in time we're satisfied that continuing that sort of service is important. We're trying to ensure that whilst we respect the risks that are out there, we have as much normality for our people on the island as possible, but without increasing significantly the risks. And that's what we'll be asking for in the review, Alex.
Thank you.
Right, we now move on to Tim Glover from Manx Radio. Good afternoon, Tim. Fast am I.
Fast am I. The 7-day test going, I think we sort of saw that coming, but you were picking up some COVID-19 cases through that 7-day test. Is there any thought of doing 12 days, 14 days, and indeed even doing tests for key workers?
Well, we do test for our key workers anyway. All our medical key workers are tested as part of that procedure. And obviously we are looking, as I say, we'll be working on how we work with key workers coming to the island. That paper will be with us shortly, and we'll announce any changes we're going to make on Thursday. But we have a problem, Tim, in that if I have a test and I'm told that I'm negative and there's a family function, 2 days later that I really don't want to miss, do I go and break my rules because I think, well, actually, I've had a test, I'm safe, it's safe for me to go out when you could have just been asymptomatic? So are you increasing the risk? Not only that, but after the 8 days, you are allowed to go back into society. OK, not into large gatherings, not into restaurants, theatres, cinemas, etc., but you are allowed out and amongst the community. Now, when the levels of infection were significantly lower in the community in the United Kingdom, we felt that the 7-day test, get the result, and then you could go out with restrictions, was a risk that was safe enough to allow. But we've seen a doubling in the last 14 days of infection rate. And if you look at the northwest, I think it wasn't that long ago, it was about 130 cases in Liverpool, Manchester-ish per 100,000, and it's now around the 500 per 100,000. So we've seen a significant increase, and therefore when you analyse the risk of allowing people to circulate in your community, then I think you've got to we felt that we couldn't allow that. For the time being, it's not something we're never going to reintroduce, but for the time being, given the infection rates, we wouldn't allow that to happen. And it's interesting to note that in our good friends and colleagues in Guernsey, they now ask for 14 days isolation. Anyone returning from the United Kingdom is deemed as a red zone area. And I think, in fact, Jersey are even potentially doing a U-turn on there, come to the island, have a test, freely move around till you get the results of the test, and they're now having a debate either today or tomorrow about whether copying very similar restrictions that the Isle of Man has had in place from day one. So thank you very much, Tim. Your next question.
Yeah, next question is just the latest thought regarding students coming home at Christmas and what preparations are being made there, and are the thoughts maybe of, if we are still at 14 days, of having hotel space for students to self-isolate in?
Well, obviously, Tim, I'm committed to getting our young people home. They will have to isolate for 14 days. So the rules that we've introduced now, the reintroduction of what we call the gold standard, was always going to be the rules that they were going to have to comply with. Because whilst they are our young people, technically they have been living in the United Kingdom. It's not as if they're someone who's gone away to visit a family, sick friend or whatever for 2-3 days and have come back. They are at the same risk level as anyone living especially in the northwest. So the 14-day rule and regulation was there. I think we've just got to be flexible. We are committed to getting our young people home for Christmas from university. However, we don't know what the situation will be in the United Kingdom, and our rules and regulations for them coming back may be different to what we currently envisage. But currently we envisage the 14-day quarantine at home. Thank you very much, Tim. Now I move on to Leanne Cook from 3FM. Good afternoon, Leanne. Fastyr Mai.
Good afternoon, Chief Minister. My first question is just for yourself. A member of the public has asked who they can contact if their workplace isn't complying with COVID rules. Would that be 111, or is there a specific sector they can contact?
Well, we have a call centre for general complaints regarding the adherence to COVID-19. I don't know, David, if you want to expand on that.
Yeah, there is actually, if they go onto the COVID website, Leanne, there is actually a health and safety number on there that they can actually contact, that helpline that will actually give them access to say that they don't believe their workplace is COVID compliant. Perfect.
And my second question
is... Just before you come on there, Leanne, we did have, obviously, public health and health and safety at work in the Department of the Environment, Food and Agriculture, who did investigations in the early days with businesses that had large numbers of people in small areas. And I know a number of investigations were carried out, but there wasn't too many breaches found. And that's another area that people can speak to if it's a workplace situation. Sorry to interrupt you there, Leanne, your second question.
No, it's okay. My second question is another query put forward by the public. Some people have questioned whether a facility such as a small convenience store could be implemented at either the sea terminal or at airports, or even both, for those arriving on island who don't have family members or friends able to get them food and supplies. Is this something that could be considered?
Well, it's part of our review. We will consider this sort of thing. I've seen people commenting about this, but having seen for myself businesses bringing over key workers and seeing the bosses of those companies putting food in the place where they're going to be staying and then dropping off food parcels throughout the week to keep them going. That, to me, is personally how I see it working. If you're bringing people over, you know they need to have the basics, the food, and you discuss with them what do they want, and therefore you should be providing, because you are effectively sponsoring those people to come over to either help your business or help the infrastructure deliver a result. And therefore, it's my opinion that you should be responsible for providing them with all that they need. And they shouldn't just have to turn up and worry about how they're going to eat. Equally, if you're a Manx resident coming back, again, you know the rules, you know what the problems will be. Are you going to have food? And you can book a delivery before you go. That's going to be delivered on the day you come back. Equally, you could buy something when you're in the UK to bring back, or it may well be that we say, yes, we we have a little shop where people can go in and buy the basics to get them over a couple of days before friends, family, or a delivery from a supermarket, etc., can be delivered. So that's something we're reviewing at the moment. Thank you very much, Leanne. Now it's Sam Turton from Isle of Man Newspapers. Good afternoon, Sam. Faster my.
Faster my, Chief Minister. I just wonder if I may please start with just reading a quote from an email that we've been sent by a reader from Mr. Baker, the DOI Minister. He said in the recent MER case, a local employer applied to bring in skills that are not found on the island in order to complete a contract and be paid. It just seems a bit weird to us that the decision seems to have been made in order for the company to finish a contract and therefore be paid, rather than it actually being vital infrastructure. And also, just secondly, has the work now been completed? And if it hasn't, will a second team be required to come to the islands in order to carry out the work?
Yeah, the second part, I don't know is the answer, Sam. It's a good point. I will look into that and put it on our website and get back to you directly on whether that work has been completed or whether they're going to have to bring over another team. I don't think all of the people had gone out, but I'll double check that. I'm led to believe it was critical infrastructure maintenance that had to be done, but we are, as I've said, we've asked for a paper reviewing how key workers are allowed to come to the UK, and we'll give you all an update next Thursday on what we've found on that and if we are going to make any changes.
Thank you. And just secondly, it's just about our students returning from university in the winter. A lot of students who come to the island during Christmas will normally work in shops, pubs, bars, restaurants. Will there be financial support for them in January if they indeed do return to university?
I can look into that. My initial reaction is I'm afraid not. They are, if they're on low income, they can apply for benefits, unemployed benefits during that period, and if they meet that criteria, then they will be entitled to it. And I know of some students who have applied for support during the summer holiday period. So it will be sort of business as usual, but I don't envisage there being a totally separate scheme set up to give them that financial support, but it may well be that some of them are eligible for it under the benefits. I don't know, David, if you've had any experience on this?
No, I think the Chief Minister's absolutely right. I think, at the moment, there won't be specific support, I would say, over the period for the students that are coming back. Obviously, we do appreciate the fact that many do normally work over the period, but I think this year, to be frank, is an exceptional year. And we need to be prepared for that. They can, of course, contact Treasury to see if there is anything that they are entitled to, but it will mean them meeting the criteria. And can I just say very quickly, Chief Minister, just Leanne asked about the health and safety at work. If anyone's got any issues, the number for that is 685 881.
Okay. Thanks very much, Sam. And last but not least, Josh Stokes from ITV Granada. Good afternoon, Josh. Faster my.
Good afternoon, Chief Minister. My first question is, we've spoken previously about random spot checks on returning residents who are self-isolating when coming back from the UK. Are any random spot checks taking place on key workers, or is it something that is only happening if people are reporting suspected breaches?
Well, we expect them to follow the rules and regulations. I'm not convinced that key spot checks are being done on all of the key workers as they come in, and that's part of the investigation that I've asked and the Council of Ministers have asked to be carried out so we can review just how we handle the key workers. Obviously, the recent publicity of certain numbers going to prison has raised the profile of key workers and what happens if they break the rules. I'm sure they will be focused on that, but equally the inspections of them by our own staff, we are employing more staff on our borders team to do the checks, to go out and visit people returning, and that may well be one of the outcomes of the review.
Just to be clear then, do we know if any random spot checks have been taken place with key workers already?
I can't give you that information at this moment in time, Josh. I don't know, David, if you're aware.
I mean, obviously, a lot of the key workers are DHSC, so I can speak from a DHSC point of view and say that we do take responsibility for our key workers. We do check that they are fully aware of the rules and that as far as we can, they are compliant with those rules. I mean, one of the things I'd like to add here, though, is it is for the employer as well because ultimately they are sponsoring the person into the island, the person who's bringing them in, to ensure that the individual is complying with the rules. They've got to take some responsibility as well. So, the people who are bringing them in to do the specific task need to have some responsibility. It can't all be down to government to check on every single individual, but certainly key workers across DHSC, as the sponsoring employer, we do indeed make sure they are aware of the rules and that they are following them.
Yeah, and as I said, Josh, we are doing the review to, as David's just said, it is up to the employer who is responsible for bringing these people over to the island to carry out the infrastructure work or help the economy, and I've read out the exact definition. If we feel that they are not liable, we may have to look to make changes to ensure that they are responsible for the actions of the people that they've brought over. But as I said, that's all part of the review, and we'll give you an update next week to all these areas. And your next question.
Okay. Yeah, thank you. My second question, we're seeing now that the North West is likely to go into some sort of region-wide lockdown as the infection rate continues there. You said the island won't be dropping to stage 3, but is it looking any more likely now, given the North West infection rate, that we could at some point go back to stage 5? And what would that take for that to happen?
Well, at this moment in time, we've said we're not making any changes, but we have, not moving our border policy, but we have obviously moved from the 7-day and then test to the gold standard 14 days of quarantine. Now, obviously, there are further steps that we can take to tighten up on those procedures. At this moment in time, family members can still move around the community. If we see a worsening of the situation, then obviously we're going to have to revisit that rule. So that's the first next step. Obviously, if we have cases in the community, we've got clear procedures in place where we'll bring back an element of social distancing, the voluntary wearing of masks on public transport. And we'll obviously reiterate all that should it happen. Hopefully it won't, but it will be incidences in the community. We have fully accepted that once you allow island residents to leave the island, some of them will inadvertently bring it back, and our procedures that we've put in place have caught all those people that have brought it back so far. And if people continue to respect the rules and regulations, we will be fine. But sadly, should it get into the community, that's when we would have to make a significant change, and then obviously we will discuss that with you straight away.
So just to be clear then, it's anything that happens on the island that would cause stage 5, not anything that will now change in the UK?
I think it's if the island is severely infected. Obviously, if something major happens in the UK, we would have to review. You can never say never, and what I've always tried to do is never have tablets of stone that this is what happens if you do. You look at the situation and decide, do we go ahead with what we've agreed to do if that's the situation? If, for say, you had 7 cases and it was all over the island in the community, your reaction might be much stronger than 7 cases in one family who have got it, or if you can see where I'm coming from. So you have to look at each situation, but we have clear procedures ready to toughen up our rules and regulations if we have to. I hope we don't have to, and I hope that going forward the UK get their numbers down and we can move to level 3A when it's safe to do so, to get our family members that are unable to see loved ones on the island. But sadly, we can't do that at the moment. The risk is too high. We're not moving from Borders 4, and we are having to reintroduce the 14-day quarantine because of the doubling of infections and more in the last fortnight in the UK, and especially in the northwest. And I don't think all the cases are being reported. I think the 14,000 is just a snapshot of the situation. But
thank you.
Thank you very much, Josh, and thank you for your questions. That's all for today. Stay safe and be prepared. Thank you for your time, and thank you for listening. Okay, bye-bye.